Autism, unfortunately, become very, very common. 1 out of 6 kids, in the present time is having some sort of developmental delay. Very, very unfortunate, right? And autism has become so common. It's very sad when I see the medical societies, the government, they're just not serious enough to handle this. I'm a functional medicine doctor, founder of the Functional MDs. I don't see kids in my practice, but I still want to talk about because so many comments come on autism. Maybe down the line, I'll make a series on talking about like a full on in depth discussion on the autism, but I really want to give like just a take from the functional medicine standpoint. So first of all, there's a hope, right? And the second thing is the functional medicine is very promising and very powerful in looking into the things which we typically ignore when it comes to the autism. Mitochondrial dysfunction is core of how a functional medicine approach is towards the autism, right? So mitochondrial disorders are rare. They're not that common, right? Only 3-4% kids, you go to the doctor, you ask them, hey, if they can, if they do, genetic analysis, the mitochondrial genetic analysis, 3-4% people, the kids can have that. Mitochondrial dysfunction is very, very common, up to 80%, right? Functional medicine providers can look into that, whether through the organic acid testing, through the metabolites. So future is going towards mitochondrial health, whether it's anti-aging, longevity. Mitochondria are core. People who don't know what mitochondria are, they are just like a powerhouses of your cells. Health of the mitochondria decide the health of the cell and many organs, and when it comes to the growing brain, neuronal health largely dependent on a strong mitochondrial health. Okay. So autism, always think about from the functional standpoint, from the mitochondrial health standpoint. So finding a good functional medicine doctor who knows in and out of these things. So please see them and see what can be done. Okay.